Hello, this is Nursing 310A here at Aspen University in Fundamentals of Nursing 1. Let's go ahead and jump right into Module 3, which corresponds with Chapter 26 in your Houston Crawford textbook, covering Personal Protective Equipment, or abbreviated PPE. So, nurses are responsible for understanding their role in preventing the transmission of infectious agents. Infection control practices are essential for providing a safe healthcare environment for the patients and the clinicians uh, who care for them. During the past several years, the number of healthcare associated infections, or abbreviated HAIs, has increased significantly, which poses endangerment to everyone in the healthcare environment that entrust themselves to be cared for at that particular facility or location. This chapter explores the basic aseptic technique and infection control measures necessary to protect the patients and the community, for that matter, from the spread of potentially harmful microorganisms. Popular visual aid that you see on the screen, obviously, with infection control, the number one thing that you can do is wash those hands and encourage everyone that you take care of and encounter in a healthcare setting. Really infectious disease is stopped up front, or at least impacted, is washing those hands. So let's go over infection versus asepsis. So infection is an establishment of pathogens in a susceptible host. Asepsis is freedom from and the prevention of disease-causing contamination. So a disease state, infection is a disease state that is caused by an infectious agent. Many microorganisms are contagious and can cause serious illnesses. Nurses cannot be familiar with every microorganism, but they can prevent the spread of infection through proper use of aseptic technique. We'll go over that more here in just a little. So let's move on and talk about identifying the normal defenses of the body against infection. So the body has many defenses against microorganisms that can cause illness. The three main defenses are the body's normal flora, the inflammatory response, and the immune system. And we'll go over these one by one. The normal flora is a group of non-disease causing microorganisms. Most commonly you hear as bacteria, but fungi and protozoa both, in addition, have the opportunity to be characterized as non-disease causing microorganisms that live in or on the body. So you ask yourself, where are these benign microorganisms found? Oftentimes you'll find them in or on the skin, eyes, nose, mouth, in the upper throat. They may be found in the lower urethra, and really the ones that get the most popular and common attention in regards to what we talk about here in nursing school is the small and large intestine. So both parts, small and large intestine, can contain normal flora. So the normal flora constitutes the body's first line of defense against infection because it inhibits pathogenic microorganisms from colonizing healthy individuals. So what's the second line of defense? The second line of defense is the inflammatory response. The inflammatory response is what backs up the normal flora when things get a little hairy. So you might ask yourself, what is inflammation? Inflammation is a local response to cellular injury or infection that includes a capillary dilation, so a large volume of blood is going to go there, and leukocyte infiltration. So talking about those real itty bitty guys that go ahead and attack the infiltrators. Inflammation causes the body to then mount and prepare the third defense, which is our immune response. The immune response is initiated by the recognition of the antigens. The antigen is any substance that provokes adaptive immune response. So again, an antigen is any substance that provokes an adaptive immune response. So what do antigens include? They include protein molecules on the surface of pathogens and non-living substances such as toxins, chemicals, drugs, or particles. The immune system recognizes and destroys substances that contain foreign antigens. And most of the people are born with innate, or often referred to non-specific immunity. So let's describe some signs and symptoms of localized infection and those of systemic infection. So let's talk about localized. Localized is, you'll note, redness, heat, pain, tenderness, potentially drainage. You potentially may note numbness or tingling. You're definitely going to see swelling and loss, and potentially loss of function to the affected area. So what's happening is those leukocytes that we talked about on the previous slide release a chemical that increases the temperature in that area. The dilation, infiltration, and increase in temperature combined are protective mechanisms that help the body neutralize and control and eliminate invading pathogens, with the intent of all of this to prevent them from surviving and, more importantly, multiplying. The body is coming in strong to stop any potential replication of those cells so that we can neutralize the invader. If you want to look at it in that kind of lens, that's absolutely what the body is trying to do. So if inflammation becomes systemic, now we're talking about things such as fever, chills, malaise or generalized weakness, increased in heart and respiratory rate. We may note lethargy, altered mental status, and all the way and up to tenderness or even enlargement of lymph nodes. So now we're talking about systemic signs of infection. So what is your main priority with a client with a localized infection? The area. What about systemic infection? Well, now we're thinking there's going to be some broad approach to go ahead and stop infection that's affecting either organ systems or potentially the entire body at large. So let's talk about some other body systems. So how does the integumentary system, respiratory, and GI or gastrointestinal systems help the body fight infection? Starting with the integumentary, actually we'll look at all of them. The integumentary, respiratory, and GI systems have a role in fighting infection. So the skin, as part of the integumentary system, is a barrier that is meant to be impermeable to most infectious microorganisms. So the skin is a barrier. It's the largest organ system on the body, and it is a barrier stopping from invaders entering the rest of the systems of the body. Any break in the skin can create a potential portal of entry or exit for pathogens. The skin contains squamous epithelial cells, which help remove microorganisms and other infectious agents. Sweat decreases the likelihood of infection because, actually, fun fact, it lowers the pH, which inhibits bacterial growth by intent. So let's talk about maybe some impacts that the respiratory system has in playing a role to stop and fight infection. The respiratory system contains cilia, the little hairs, and mucus, which move or trap foreign bodies, and therefore the intent is to decrease the risk of infection. The respiratory system is equipped with proteins that have antimicrobial properties and promote phagocytosis. So that's when one cell devours, essentially eats another cell. So let's talk about the gastrointestinal system. The GI system plays a role because it actively helps the body fight infection. The normal flora in low pH of the GI tract prevent the colonization of pathogenic microorganisms by secreting toxic substances or competing with the microorganism for the nutrients they need to thrive. So if an invader gets in the GI tract, obviously the GI tract's intent or up front is to let's go ahead and get those nutrients to the body before anyone else can get to them. And it's also equipped with, like we talked about, a lower pH to actually make it uncomfortable and kill any pathogens that may enter into the GI tract. So let's talk about the link in the chain, or the links in the chain of infection. So as you see in the middle of this representation here, you have the chain of infection in 6 little different areas that we'll talk about. That if we can stop or break any one or multiple links, there's a really, really, really good chance that we can stop infection. So my picture is actually different from the one in your book that you'll see on page 474, but it really kind of covers the same ideology and ideas. Again, your image can be seen on this thought in page 474 of the textbook. To understand how to prevent the spread of potentially harmful microorganisms, nurses must understand how the chain of infection works. So the chain of infection has 6 main components, like we said. The infectious agent, the source, which is also referred to as a reservoir or host, the portal of exit, the mode or means of transmission, the portal of entry, and lastly, there must be a susceptible host. Those are your 6 parts. So infectious agents are the first link in the part. They are the first part of the chain of infection that is necessary to spread disease-causing organisms. So the first link of the chain is the infectious agent, also called the pathogen. Infectious agents can be bacteria, viruses, fungi, or parasites. So bacteria are single-cell organisms that live as normal flora on or in the skin and eyes, nose, and mouth, lower urethra, lower intestine, and large intestine, which we talked about earlier. They can cause disease in the human population when they overgrow as a result of the immune system being compromised, or if they strategically enter different areas of the body. Bacteria are identified when a sample is taken from the body and cultured. Exact antibiotic sensitivity is tested so that the appropriate antibiotics can be described if we're going to go ahead and use pharmaceutical intervention for the disease process that we are trying to tackle. Viruses are the smallest microorganisms. Viruses can reproduce inside of living cells or the host cell and are responsible for causing many different complicated types of disease. These range from the common cold all the way to acquired immune deficiency syndrome, or AIDS. Viruses cannot be killed by antibiotics. Certain antiviral medications are used to manage the symptoms of a viral infection. So bacteria can get antibiotics, viruses cannot. We have to tackle them with much more complicated medical interventions, including antiviral medications. I'm talking about fungus. Fungus, like bacteria, are those small single-celled organisms that can cause infection. Mold and yeasts are often common examples of fungi. Fungi are present in the air, the soil, the water, and are responsible for conditions such as athlete's foot, ringworm, and yeast infections. Infections that are caused by fungi are treated, now a third class, antifungal medications. Bacteria get antibiotics, viruses get antivirals, and fungi get antifungal medications. The last one we're going to talk about are parasites, which are organisms that live on or in another organism. Parasites are typically transmitted by sexual contact, insects, and exposure to other domestic animals. They cause many diseases in humans, though. So, for instance, a protozoa can cause malaria. Helminths are actually responsible for intestinal worm infestations. And another one you'll hear about are arthropods are responsible for transmitting many skin and systemic diseases such as malaria. The second link of the chain is the source of the infection, also called the reservoir or the host. I know this is a lot of information, but stick with me here. The reservoir can be an inanimate object, human being, or animal, or potentially insect. The inanimate objects include contaminated surfaces or equipment, medications, air, food, or water in which a microorganism can find nourishment and survive. Human sources of infection are healthcare personnel, maybe family, maybe friends, or a patient can actually be. Insects or animals such as rats, birds, pigs, and cows have the opportunity and ability to spread disease and have been reservoirs for many epidemics in the past, such as avian flu or mad cow disease. Infection spread requires a portal of exit. So microorganisms escape through emesis, sputum, urine, stool, blood, genital secretions, and wound drainage. The microorganism that must have a way to travel from the source to the susceptible host. The form of transformation is referred to as modes or means of transmission. This mode of transmission includes potential contact, airborne, vehicle, droplet, or vector-borne. Most microorganisms are transmitted by contact. So direct contact involves a physical transfer of a microorganism. An indirect contact occurs when the organism is transferred by means of contaminated objects, such as a dressing or a contaminated needle. Airborne transmission occurs when microorganisms are dispersed by air currents and then subsequently inhaled or deposited on the skin of a susceptible host. Droplet transmission occurs when the mucous membranes of the respiratory tract, so think your nose, your mouth, and even your conjunctiva, are exposed to the secretions of an infected individual. Droplets cannot remain suspended in the air for long periods of time. And fun fact, they very seldom travel more than 3 feet from the source. Examples of illnesses transmitted by droplets would be influenza and RSV, or respiratory syncytial virus. Airborne transmission and droplet transmission are often difficult to differentiate. Key things between both of them: microorganisms travel through the air in both cases. So for both airborne and droplet, the microorganism is going through the air. But the differences between the two modes in the size of the organism, because smaller microorganisms can travel ridiculously long distances and remain suspended in the air. The smaller microorganisms, travel by air. Large microorganisms that cannot travel long distances are going to need much closer modes of transmission, so they are not able to be suspended and carried quite literally by the wind. Those droplets are heavier, so those organisms are heavier, so they can only go small distances and be carried on a droplet. For the chain of infection to continue, the microorganism to be successfully transmitted from a primary host to a susceptible host, there must be the portal of entry. There are many different types of portal of entry. There could be the GI tract by eating it or ingestion. There could be the organism obtains entry via mucous membranes. They could be entering via the respiratory tract via inhalation. Sorry about that. The chain has 6 main components, the last being the susceptible host. So once all of the previous 5 parts occur, there has to be a host that is susceptible for the growth and colonization of the organism. And that really provides you a high-level overview on the links in the chain of infection. And again, your image in the textbook will provide you a slightly different view. So there's a bunch of different ways to understand this chain and how you can break the link in between each chain. So let's talk about conditions that promote the transmission of healthcare associated infections, often referred to in the abbreviated form of HAIs. HAIs cost anywhere from 28 billion to just short of $39 billion annually in healthcare. The impact includes delays in recovery, treatment, and discharge, longer hospital stays, potentially permanent disability, increased costs associated with prescription medications, potential loss of earnings, depending on what the impact is and how long the impact occurs, disruption of family routine, anxiety, pain, and up to and including death. Now, HAIs are something you're never not going to hear about in nursing. It's always going to be important because healthcare facilities, one, genuinely care and they want to have people healthy and not come to the hospital and get more sick. And two, the actual financial burden on everyone in the healthcare system in the United States is so astronomical. Everyone really needs to do their part. The cost of HAIs are often not reimbursed. For example, if a client enters into the hospital setting for maybe a broken hip and they obtain a pressure ulcer or pneumonia while in the hospital, the cost associated with that pressure ulcer or a case of pneumonia are not covered by insurance, and the facility will actually have to absorb and eat the cost associated with that HAI, that hospital or healthcare associated infection. Data about HAIs are collected by the CDC to improve infection control methods used by healthcare providers. HAIs are associated with the use of medical devices such as catheters, ventilators, complications after surgical procedures, contagious transmission between patients and healthcare workers, and the overuse of antibiotics. Think creating superbugs. HAIs may be caused by drug-resistant microorganisms. One you might popularly hear of is methicillin-resistant Staphylococcus aureus, or MRSA. You might hear of VRE, or vancomycin-resistant enterococci, and other bloodborne pathogens such as hepatitis. These are formerly referred to as nosocomial infections, and these infections that are acquired because the patient was receiving care in a healthcare facility. Polite reminder, we keep seeing these visual aids. Washing your hands as the patient and the healthcare provider in synergistic impact is the most effective method for preventing any and every HAI. So let's talk about resistant organisms. We have drug-resistant organisms. So microorganisms adapt to their environment to compete for survival. All these microorganisms are out there playing survivor, trying to be the biggest and baddest. So a microorganism is considered resistant if replication cannot be stopped by 2 or more antibiotics sequentially or simultaneously. So if 2 antibiotics are given at the same time or 2 antibiotics back to back, that microorganism is considered resistant if it can replicate in conjunction with 2 antibiotics. Resistance is observed for the community and hospital-acquired infections. Microorganisms that have developed resistance in the hospital setting include what we talked about earlier: MRSA, methicillin-resistant Staphylococcus aureus, VRE, C. diff, or Clostridium difficile are other examples. Many factors contribute to the resistance, including prescribing antibiotics for non-bacterial infections. Use of appropriate or inappropriate antibiotics, use of inappropriate antibiotics for the infecting microorganism, and incomplete courses of antibiotics. Infections are becoming increasingly hard to treat. Some microorganisms cannot be effectively destroyed by any known antibiotic. Now, this isn't a message to spread doom and gloom and scare you or intimidate you, but these are the realities of the healthcare setting that we are going to be a part of. So simple things like washing your hands and following proper protocols really do make an impact as these disease processes change. Until recently, new drugs have been provided in time to treat bacteria that had become resistant to older antibiotics. This is no longer the case because the cost of developing new antibiotics is astronomical, and the development of new antibiotics has been slowed because of the cost and the inability to allocate the appropriate resources to get the job done. Drug-resistant microorganisms pose a considerable health risk for the general population and healthcare workers. So using the appropriate PPE or personal protective equipment and hand washing in conjunction decreases the risk for transmission. Blood-borne organisms. So let's talk about blood-borne organisms. Several blood-borne pathogens can put patients and healthcare providers at risk for infection. They include hepatitis B, hepatitis C, and HIV. Exposure occurs through contact with contaminated blood or bodily fluids. Exposure does not necessarily mean disease development, and that's a common misnomer. Again, exposure to any of the above does not necessarily mean disease will develop. However, exposure and disease can develop and can be decreased with the appropriate precautions and barriers, so think proactively. If exposure occurs, several steps can be taken to decrease the risk of developing the disease you were exposed to. These steps vary by individual institutions, but anyone who is exposed to a blood-borne pathogen should have baseline laboratory work completed to check, again, for the disease that they were exposed to. So testing if you were exposed to HIV would look different from testing if you were exposed to hepatitis, either B or C. If the patient source is known and the patient is tested, subsequent testing and medical prophylaxis may also be warranted. So, moral of the story, depending on how the test results come back, your plan of care due to exposure to that blood-borne pathogen could be different than someone else who was not exposed as dramatically or may not have been exposed directly at all. Assessment. How will you perform an assessment on a client with a suspected infection? That looks totally different than if you had an assessment for someone with just a broken leg or generalized weakness. Infections are classified as acute or chronic. Acute infections develop and run their course rapidly. Think of your average sickness for like colds, coughs, ear infections. They only last maybe 1-2 weeks. Chronic infections are infections like mononucleosis, which may persist for months or longer. These may be a large wound that becomes infected or potentially infection of a bone. Infectious disease such as hepatitis and AIDS may last for years or a lifetime. Some patients with an infectious disease may have no visible symptoms at presentation, whereas someone may have depending on what's going on, been able to chronologically document or even photograph what has been going on. Confusion is a common presentation in the elderly and geriatric population and is often the first indication of an infection such as pneumonia or often a urinary tract infection. So what questions do you ask? The nurse observes a patient and their general appearance to detect infection. But we can also do other things like ask open-ended questions that may really hone in and help determine what's going on. Questions like, do you feel tired or fatigued? Do you feel short of breath? Do you often have chills and require a blanket when others in the room are absolutely comfortable? What's your appetite been like? Do you have any areas where you're noting pain, redness, swelling, warmth? Do you feel that you have a cough or difficulty swallowing? Questions like that. So the effects of the infection on the body's defense system. Infections are classified as acute or chronic. These acute respiratory infections develop and again run their course rapidly. So let's think about some of the vital signs. You will notice like a sudden spike, maybe in temperature, maybe in blood pressure. This would be sudden onset to go along with the acute issue or the acute disease process that we're documenting on. Whereas if it was more chronic, we may know a very long period of time of sustained higher blood pressure versus just a real quick spike. If you're thinking of like a heart monitor, it would be a large uptick and then come back down. Someone with chronic issue may note across their various vital signs a steady or maybe plateau progression of vital signs. And we can look at things such as nutritional assessments and other risk assessments as the house to really be that vigilant nurse and consider what's going on and how susceptible that client is. Let's talk about some of the laboratory and diagnostic tests. So tests include a complete blood count, or abbreviated CBC. The normal white blood cell count, talking about the differential white blood cell. The normal white blood cell count for adults is anywhere between 5,000 to 10,000 cells per mm cubed. The differential white blood cell count is the type of white blood cell in a sample of 100 white blood cells. It helps determine whether the body is mounting a proper immune system to an infection. A shift to the left might say higher percentage of neutrophils than normal indicates an infection. So again, a shift to the left. So a relative increase in the immature formation of blood cells, those neutrophils, indicates infection. Culture and sensitivity testing of the blood, urine, stool, or wound drainage could be indicated. When an infection is suspected, and the culture specimens can be obtained to identify the pathogen responsible. This specimen is sent to the lab where a proportion of it is placed on culture medium. A culture is considered positive when sufficient bacteria are found growing on the medium. After the pathogen has been identified, after that pathogen has been cultured and identified, it is exposed to various antibiotics, and the bacterial growth is monitored to determine its sensitivity or what the antibiotic therapy is doing. From there, healthcare professionals are able to say which antibiotic therapy would be most effective to treat that infection. Culture of a specimen determines which microorganism is causing an infection, and sensitivity testing determines which antibiotics, if any, can be used to treat the infection. The ESR measures the degree of inflammation in the body, and the result can be an indicator of an infection. An ESR that remains elevated indicates a poor response to current therapy whereas an ESR that decreases indicates a good response. An ESR test is performed by timing how fast red blood cells settle to the bottom of a tube of whole blood. They settle faster when inflammation is present. So how about proper hand hygiene? We hear it again. Who provides proper hand hygiene? Why do we need to perform proper hand hygiene? Diligence in performing these interventions decreases the likelihood of spreading infections from one patient to another in a healthcare facility. So we ask, when do we provide proper hand hygiene? How do we provide proper hand hygiene? Hand hygiene includes hand washing with soap and water and the use of alcohol-based sanitizer, or in conjunction with the use of surgical hand scrub. It is important, it is the most important act that a nurse can perform to protect the patient, self, and any other patient from the spread of infection. Hand hygiene breaks the chain of infection by interrupting the mode of transmission. So we talked about that cyclical chain. We're breaking one of the few first chains and stopping the rest of that cycle from repeating. Hand hygiene breaks the chain of infection by interrupting the mode of transmission. There are times when hands must be washed with soap instead of using an alcohol-based sanitizer. These include when hands are visibly soiled, or when we are caring for clients with uh, something such as like C. diff, Clostridium difficile, or vancomycin resistant enterococci, VRE. These are type of viral uh, issues that we require hand hygiene. They can be bacterial also, but they require hand hygiene, and they are resistant. So the alcohol sanitizer is not going to just do the trick. A surgical hand scrub must be performed before all surgical procedures and before other procedures as necessary. This is an intense type of hand hygiene that is performed with an antiseptic agent. A disposable sponge is used to scrub the hands, fingers, and wrist area to reduce the number of microorganisms on intact skin. And for your own visual aid, go ahead and check out page 486 in your textbook for skill 26.1. Let's talk about PPE a little bit more, that personal protective equipment. What body parts are these items going to protect? So a mask protects against the transmission of infectious agents through the air. The individual is protected against large particles that travel only a short distance, again, usually less than 3 feet, and small particles that can remain suspended in the air and travel much farther. The effectiveness of masks is decreased when they get wet or are worn for too long periods of time. Obviously, the gown is going to protect anything from touching, as you will see on one of the next visual aids. Anything, it acts as another layer, essentially an extra layer of skin to act as a barrier. We can talk about respirators, such as the special particulate respirators. Most popular one you hear about right now are the N95 masks. Are used when a patient is suspected of having a contagious airborne disease, such as tuberculosis or COVID-19. These special masks look like regular masks, but they fit more securely against the face. The nurse is fitted to determine which size of mask to use. The nurse who works in high-risk communities should have a particulate respiratory on hand at all times. Waterproof gowns are used when there is the possibility that healthcare providers' clothes will become soiled. Gowns are only used once and then they are discarded. Some healthcare facilities use disposable gowns. Most healthcare facilities use disposable gowns. It's not often you see them being cleaned after each use. PPE is personal protective equipment that healthcare personnel use to stop infection and the spread of infection. So gloves, masks, goggles, face shields, shoe coverings are all examples that can be used by themselves or in conjunction with everything else listed. And here are some really good videos you can watch that talk about donning and doffing and other information for PPE. This is a good visual aid that goes through donning PPE before contact with the patient, generally before entering the room. You want to use very carefully because if used improperly, you can actually spread contamination. The intent, again, is to not spread contamination by using PPE. We want to remove and discard it carefully, either at the doorway or immediately outside of the patient's room, depending on your facility's policies based on the disease process specifically and what their rules are for removing PPE. We want to remove respirators outside of the room. That's on the common theme you'll see pretty much in every facility. You want to remove the respirator outside the room. Immediately perform hand hygiene when done removing PPE. Let's stop the chain right up front. So we may have potentially exposed ourselves to contaminated PPE. Once completely removed, the first thing we need to do is perform hand hygiene. So we have another visual aid that breaks down how to safely remove the PPE, which we just talked about, but here's a good visual aid actually recognized by the CDC on proper ways, step by step, to remove gloves, goggles with or without face shield, gown, your mask and or respirator, and again, removing any PPE with proper hand hygiene. And lastly, the same kind of thought. So how to safely remove PPE. Let's explain the procedures of each isolation category. So we have precautions and isolation. Use of standard airborne, droplet, and contact precautions reduces the transmission of pathogens. Standard precautions are used with every patient. They are standard. They are used with every patient you will encounter. They are the practices that prevent the spread of disease and infectious organisms by minimizing the risk of transmission or exposure. Because it is not possible to identify patients who may or may not be infectious at any given time, the nurse practices standard precautions in dealing with every patient to protect all their other patients, visitors, and peers and staff from exposure. Transmission precautions, such as airborne, droplet, and contact, are used in addition to standard precautions to decrease the transfer of highly transmissible pathogens. Each transition-based precaution requires the use of very specific PPE to prevent the spread of communicable illness. Patients are immunocompromised, such as low neutrophil count, may be placed in protective isolation. This type of isolation protects susceptible patients who may have not been able to fight infection from microorganisms in the environment. Patients who are undergoing chemotherapy, radiation, or potentially bone marrow transplants, or potentially patients with severe burns may be placed in protective isolation. Patients with their families can become partners in preventing the spread of infectious illnesses. Lastly, the nurse creates a culture of safety when standard and transmission-based precautions are followed and when education is provided to patients, families, and the healthcare team about the hazards of not following the specific precautions set in place. Contact precautions. Contact precautions are used when a known or suspected contagious disease may be present. Direct transmission is contact with the patient. Indirect transmission is contact with equipment or items in the patient's environment. These examples include things that we've already kind of talked about. You have multiple drug-resistant organisms, potential drainage from wounds or open areas that have certain organisms that can be cultured. And scabies and herpes simplex virus are also examples. Droplet precautions. Droplet precautions may be generated when an infected patient coughs, sneezes, or talks. So this is used when known or suspected contagious diseases can be transmitted through large droplets. The droplets may be produced during a medical procedure, such as suctioning, endotracheal intubation, cardiopulmonary resuscitation, or chest physiotherapy. Examples here include rubella, mumps, diphtheria, and influenza. Airborne precaution. Transporting a patient who requires airborne precautions should be limited. However, when necessary, the patient should wear a surgical mask. An N95 respirator mask is not required usually. That covers the mouth, so a surgical mask that covers the mouth and nose to prevent the spread of infection. Moreover, the department where the patient is being transported should be notified about the precautions before the transport occurs. This really takes a win-win, setting everyone up for a success approach between unit and unit, and the handoff communication is critical. Examples here include tuberculosis or TB, chickenpox, which is your varicella virus, and measles or the rubeola. Protection isolation. This varies according to the reason that the patient's immune system is compromised, and a variety of protective precautions may be used, again, depending on what's going on. A positive pressure room with a HEPA filter may be required. A mask is required for anyone entering the room or for when a patient is leaving the room. Meticulous hand washing is essential. The patient must be assessed carefully for signs and symptoms of infection. No live plants, fresh flowers, fresh fruit, or vegetables, sushi, or blue cheese may be brought into the room because they may harbor bacteria and fungus. And these are all kinds of specific thoughts that come along with a variety of protective precautions that may be used dependent on why the patient is immunocompromised and what's going on there. And for our last slide together on today's content, let's talk about the difference between medical asepsis and surgical asepsis. Medical asepsis is often referred to as clean technique when juxtaposed to surgical asepsis, which is sterile technique. So clean technique, or that medical asepsis, is including hand washing and wearing gloves and gowning and disinfecting. Again, hand washing, wearing gloves, gowning, and disinfecting. Surgical asepsis is used for surgical interventions and invasive procedures such as catheterization, procedures that invade the bloodstream or potentially break the skin, dressing changes, and wound care are all examples of where you would use sterile technique. I hope you enjoyed this lecture and got quite a bit out of it. Again, this is Module 3 here at Aspen University, N310A. Thank you.